My mother, Ruth Bellingham, died Christmas 2004 after a long illness of dementia and Alzheimer's, really spread over probably 6 or 7 years. Then began this terrible game playing that goes on, I think, with loved ones and the patient, where the patient begins to sense that there's something wrong, but doesn't know what it is. And my mother she was never grumpy, but she was always insecure, actually, about her reading and writing. She wasn't very educated, and I think we as girls, when we'd gone through life, had kind of criticised, you know, Barbara was a photographer, I was an actress, and Jean was a nurse. She had, now we realise probably in this day and age, she had dyslexia, but she was not stupid. That's for certain, but she didn't read a lot. But as I say, things started to slip, and she started to repeat herself, all the obvious things, and she got a bit tetchy. My father's a very quiet, very calm man, but actually very much the head of the household. And where I noticed it at weekends is that my mother would overcompensate, in a sense that she was much more bossy than she used to be, and she was obviously trying to control the lunch, say. So if in the old days Dad says, well, I'll clear the table. No, don't do that. And it would create an atmosphere and everybody would sort of feel slightly embarrassed, and then you'd make a joke. And I can remember at one point, very early on, but taking her arm and saying, Mum, calm down. I am calm, I'm calm. And I could see absolute panic in her eyes, absolute panic, and I didn't understand. I thought, what's she panicking about? You know, nothing is so bad that you should panic about whether the table is set in the correct way. I say all this because it's such a gradual deterioration, and in fact extenuating circumstances were such that Mum actually fell over and broke a hip, and my father very much cared for her, so they were in that mode, starting to get into that mode. But then again, Mum was very frustrated by her lack of movability, and Dad then actually fell and broke his neck, and then couldn't help Mum. So we've now got Mum disabled with Alzheimer's, Dad frustrated. And I say all this because what I then came to visit was two people who were grumpy with each other rather than helping each other. And the more that my father got frustrated with his own inability to cope because of his neck, my mother would try to overcompensate and try to organise him, and you could see perhaps even quicker, or she could feel even quicker, that she was losing her grip. As far as I'm concerned, in terms of caring, when it reached the point where actually we had to sit Dad down and say, Dad, you can't do this. So you've got that whole thing about a man who loves his wife, has been together for 40 years, can actually not care for her. You've got his emotional fragility, and then you've got my mother's emotional fragility, which was, you know, not paranoid, but searching, looking at you, think, are you taking the mickey? Are you, that terrible sort of self-defensive attitude. Now, when the carers come in, I think what's really, really hard when you're dealing with dementia, and also because physically she was very disabled at this point, in terms of washing her, and we got her a bath that she could step into, is when it's medical and you deal with it and you can wash her and clean her up and all, that's all fine. And it's efficient, and most people haven't got a lot of time, carers haven't got a lot of time to, come on then Ruth, get in, come on. Now, do you want this on or do you want that on? Do you want to wear these? This is the panic, this is the nature of and the horribleness of this illness. Because that's what panics the sufferer of dementia.